Hi, I'm Steven Silvestrak, and buckle up because for the next few minutes we'll explore sociological theories. After defining sociological theory, we'll examine 4 major theories and how to approach MCAT questions on those topics. Something to make sure to pay attention to is that each of these theories, functionalism, conflict theory, symbolic interactionism, and social constructionism, are seeking to answer some important whys. Why does our society operate the way that it does? And why do people experience struggle? Ultimately, our goal is to be able to recognize the 4 main theories and apply them to scenarios on test day. So, if the MCAT told you that the Eisenhower Expressway in Chicago was built in such a way that resulted in isolating several African American communities from the rest of the city, we'd want to make sure we could recognize which theory most readily applies. Sociological theory seeks to explain why society functions the way that it does, and in doing so, provide insight into how society can face and even overcome problems. If you were to sit down with someone and discuss a challenge faced by society, be it education, healthcare, hunger, homelessness, poverty, what have you, beyond acknowledging that a problem exists, chances are that you would identify different causes for the problem. No one answer adequately explains all the facets of why a societal challenge exists. It is a similar story with sociological theories. There is no one solution that encompasses all the facets of social interaction. But all the theories will identify a particular problem and connect the facts surrounding that problem in an effort to explain why our society operates as it does. And when examining society, we can do it at 2 levels. First, the micro level deals with individual experiences, and then the macro level focuses on institutions and how these large structures affect behavior. Remember that these 4 theories we will examine aren't in competition. Instead, these different theories represent different lenses through which we can observe human interaction. The AAMC expects us to identify which lens is being used in a particular context. Functionalism is the first and oldest of the theories. It has a few variations on its name, all having to do with function and structure. Major contributors to this theory are Conti, Spencer, Merton, and Durkheim. Essentially, functionalism recognizes that society is made up of many parts, each with a function. Much like our bodies have distinct organs that each fulfill a different role but rely on each other to work, all the different parts of society must also fulfill their individual roles so that overall, society functions. Functionalism tells us that in order to understand a society, we must recognize the different parts of society and the different roles each component plays. This is a macro approach to societal understanding. The breakdown is pretty straightforward. If every subpart is fulfilling its function, society is in a normal state. But when some functions are not being fulfilled, then society is in dysfunction. In order to fulfill its function, parts of society must take action. These actions will have both manifest and latent functions. Manifest functions are purposeful. For example, if you were to treat a bicyclist in the emergency department after she was hit by a car, you may take her for further testing to assess for any brain damage. You, as the physician, would be fulfilling a manifest function, testing for diagnostic purposes. However, this action that you take will have latent function as well. These latent functions are akin to unintended consequences, and they may be helpful, hurtful, or neither, and they will augment the manifest function. For example, in taking a CT scan of your patient, you may discover no traumatic brain damage, but you may find that she has a pituitary tumor. Or, by ordering a CT scan for the bicyclist, you may end up delaying treatment for a stroke victim who, unbeknownst to you, arrived at the hospital 5 minutes after you sent your patient into the hospital's only CT machine. There are so many examples. Eating a family meal manifests as feeding everyone, but will also latently reinforce family bonding. Cleaning out your closet by donating clothes to charity manifests with more closet space, but may latently provide positive feelings from helping others. The second social theory to know for the MCAT is conflict theory, which is derived from the works of Karl Marx, who you've probably heard of. The focus of conflict theory is power. Marx believed society was fragmented into groups, and the struggle each group has for power and the ability to control and coerce other groups drives society's direction. The group with the greatest political, economic, and social resources maintains social order. There is constant opposition, but whatever consensus does exist is the result of unification around the more powerful and dominating group. Because conflict theory is a study of societal groups struggling against each other, and not of the individual interactions, conflict theory is another macro sociological theory. Conflict theorists see race, gender, and class as the most predominant conflicts in society, and because of the unequal allotment of resources between these groups, the powerful will coerce the less powerful to align with certain values. The theory is that if the less powerful groups had more resources, they would act in their own interests instead of being coerced into acting into the interests of another, more powerful group. Critics of this theory suggest that focusing on the ever-changing dynamics of power is too negative an approach to understanding our struggles as a society. But the MCAT doesn't particularly care about how well different groups accept different ideas. Instead, the expectation is that we can understand and apply all of these sociologic theories in novel situations. Moving on to micro-theories. Symbolic interactionism has its roots in the University of Chicago in the early 1900s, and because of this it is also called the Chicago School of Thought. The early 20th century was a time of massive immigration into Chicago, and the university used the city as a vast resource to study how different groups, despite massive cultural and linguistic barriers, were still able to communicate, function together, and ultimately assimilate through the use of symbols. At its core, symbolic interactionism believes that all human interaction is only understandable through the exchange of meaningful communication in symbols. For example, communication could occur through gestures and hand signals, which will vary wildly between cultures, or through facial expressions, which have more cross-cultural similarities, or a myriad of other ways. Overall, there are three main principles in action. First, humans act on meaning. For example, if you see someone crying, you may console them, but only if the meaning of the tears is sadness. Happy tears would not result in consoling. Second, the origin is social interaction. When a child sees his parents smile, he will imitate that smile. Understanding that the smile means happiness only comes later. Third, social action is the result of all of these individual interactions. Because symbolic interactionism is based on the interactions of individuals, it is a micro approach to social theory. A key differentiator of symbolic interactionism is that people are acting in society and not being acted on by sociologic factors. The final sociologic theory for the MCAT is social constructionism, and it deals with how individuals and groups perceive social realities. It starts with the roots of our social and cultural life that generate individual perceptions and reality. These perceptions, in turn, reinforce the larger social construct. There is a cycle and constant interaction between the institutions and individuals. Let's explore a concrete example illustrative of this flowchart. The U.S. Department of the Treasury, in conjunction with the Federal Reserve, create money. This social institution creates value in this green-tinted cotton paper. Individuals perceive these bills as valuable, and through their own interactions reinforce that belief in others and continue the overall cultural norm of money having value. Berger and Luckman coined the term social constructionism in their 1966 book, The Social Construction of Reality, and have made significant contributions to the understanding of deviance, self, gender, race, education, emotions, family, and health. Social constructionists tend to question society's classification of deviance, as groups can identify deviant behavior differently. It is important to remember that in social constructionism there is a cyclical process where individuals contribute to the generation, maintenance, and even transformation of social realities. So, any social norm is subject to change. Now on test day, the AAMC will expect us to be able to match these sociological theories with example scenarios. So, for an MCAT question, we'll want to ask ourselves to identify the key social factors highlighted by any given scenario. Is there a problem due to a particular function of society not being fulfilled? If so, we should consider functionalism. Is power or coercion between societal groups a major player? If so, conflict theory is a major contender. Is symbolism or some other type of social interaction involved? Then think of the Chicago School of Thought, symbolic interactionism. Is there reference to how individuals or society construct reality? Because then social constructionism is the leading answer. Let's try an example. In this scenario, a doctor notices a 30-pound weight gain, making a previously presumably normal body mass index patient now overweight. However, the patient reports feeling happier and healthier at her new weight because she feels more accepted and no longer gets comments about being too thin. Which sociological theory most applies? The social factor here involves this patient and her friend's family, and their belief that having a normal BMI or being too thin is a bad thing. This is a reality reinforced by her social group, and that makes B, social constructionism, the correct answer. How about this case? In the 1970s, the Baltimore police went on strike. As a result, crime in the city skyrocketed, and the Maryland State Police had to intervene. Which sociologic theory is represented here? Here, the social group of the police stopped fulfilling their function, and the abnormal societal state, higher crime rate, resulted. So D, functionalism, is the correct answer. In this example MCAT question, we learned that according to the CDC, nearly 20% of deaths are due to tobacco-related health problems, and smokers have a mortality rate 3 times that of non-smokers. However, cigarettes are still big business, and the U.S. is a leading tobacco producer. There is speculation that this is because the tobacco industry is so profitable, the producers can continue to benefit at the expense of the consumers. Which sociological theory best applies? Weaker groups acting against their best interests, and more powerful groups prevailing. This is a dead giveaway for answer choice C, conflict theory. In this example, an elderly man in pain visits the doctor. During the appointment, the physician immediately started entering information into the computer. After a brief physical exam, the physician inputted the patient's answers and her clinical observations, makes a diagnosis, and offers her treatment recommendations to the patient. Afterwards, the patient is dissatisfied and concerned the doctor is not qualified to treat him. Which sociological theory fits with this scenario? The patient believes the doctor is relying on technology to diagnose his pain. The strict use of the computer demonstrates to the patient that the doctor needs the computer, which, in this case, sends a message that the physicians can't diagnose without the machine. This type of interaction, in this case non-optimal and with a barrier, deals with choice A, symbolic interactionism. Let's do a quick review of the differences between the 4 major sociologic theories the AAMC will expect you to know for test day. Functionalism is the oldest theory, deals with each component group of society fulfilling a particular role, and also encompasses the concepts of manifest and latent functions. Conflict theory is based on the work of Karl Marx, and deals with individuals and groups competing within society for their own best interests. The conclusion here is that the powerful will coerce the exploitable to act in the best interests of the powerful. Symbolic interactionism started in Chicago in a hotbed of immigration activity. It deals with humans acting on meaning, interaction being the source of that meaning, and individuals' interactions and actions shaping society, not the other way around. Social constructionism was first coined in the 1960s and describes the balance between societal realities and individuals, notably how individuals create, maintain, and can alter socially accepted norms and realities. In your review, make sure you can relate how each of these 4 theories connects to those whys. Why does our society operate as it does, and why do people struggle? And thus concludes our examination of sociologic theories for the MCAT. Please go back and review as necessary, and as always, best of luck on test day.